Hello, everybody, on this April the 3rd of 2013. Um, Reading something very interesting online, and boy, if this won't make you stop and think the next time before you go in to have any kind of surgical procedure, I don't know what will. This 25-year-old man, his name was Marek Lipinski. He was an entrepreneur. He was part owner into a Tactical 3D Dimensions company, and that they developed software and hardware for night vision devices. And so his future was bright. He needed to have 2 wisdom teeth extracted. His sister says he was very nervous about it in the first place. You know, some people are, some people aren't. But in his case, he was nervous about it. You really don't think anything about it because it is a procedure. So he had texted his sister and told her, I'm going in. I'll call you when I'm out. And that was the last time she heard from him. He had gone into the dentist office of Dr. Stephen Paul, who's an oral surgeon. And he had been about, let's see, how long does it say? He had been a few minutes into the procedure when he started to cough, and so they administered propofol. You know, propofol is what Michael Jackson OD'd on. So the dentist office gave him propofol. Well, so because he was coughing. Then they had to, his oxygen went from 99% down to 45%, so they had to call the paramedics. And the paramedics came, and they took Mr. Lipinski to the hospital where he died. There's a couple of things that they said. One of the doctors told the sister that it looks like an overdose of anesthesia. So they could have given him too much of an overdose of propofol. Like I said, the same thing that killed Michael Jackson. But the thing that sticks out in everybody's mind in this case is they found a piece of gauze in his throat. So it would seem like maybe he was choking on that piece of gauze. You know, how they, I guess, swab the gauze in your mouth to soak up the blood. I always thought they had a little suction thing, but I don't know. And so they found that gauze in his throat. So now, could he have choked on that gauze, or was he OD'd on propofol? They, of course, checked his medical background and, did all kinds of tests and everything, and found that he had no underlying health problems. So whatever happened in that dental office. So I would be a little skeptical about going to that dentist again. Now his sister, Natalie Lipinski, she is a nurse. So, she knows a little bit about something's going on. She said that she found her brother was given at least 6 different sedatives by the surgeon. If you're having 2 wisdom teeth pulled, why do you need 6 different sedatives and then propofol? That doesn't make sense. And so here they was talking about his medical record shows instruments measured in his oxygen saturation levels for every 5 minutes. For the first 20 minutes of surgery, levels stayed at 99%. At 25 minutes, there was no register of oxygen. And at the last entry, registered at 43%. So if there was, after 20 minutes, if there was no level of oxygen, it doesn't say how long they waited for the last entry of 43%, but that means during that time they had been doing something. They had to either been giving him, trying to help him breathe, giving him CPR and all that while they waited for the paramedics, maybe. But the CPR is not going to do any good if you have gauze in your throat, because that's just cutting everything off. No, These people need to be investigated very much. And so, that'll make you think the next time you want to go to the dentist. And until next time, bye-bye.